My main problem was what we call clearing while scuba diving. When you go diving, you have to equalize your ears. Now, a lot of people have been in airplanes and they know that as the plane descends, you have to kind of blow into your ears to pop them, otherwise you can have a lot of pain. Same thing happens during diving because of change in pressure in the water. What was affecting me were my sinuses here. They were not clearing like they should, so the pain was tremendous. It's sort of like imagine your worst headache and multiply it by 3. I'd had some work done at the same clinic 20 years ago, and the sinus surgery did a lot of good then, but then after about 10 or 15 years my symptoms came back, and that's when I came back to this clinic, and I'd heard about Dr. Wiggs' new procedure, and that's why I wanted to see what that was all about. He did, of course, do an examination and some x-rays. I believe it was a CT scan, and I believe it was here in the office, very convenient. The day of the procedure, he numbed things up with some Q-tips up the nose and passed a scope up like he did for the diagnostic exam, and then passed up some wires, and the balloon that he dilates with goes over the wire, and injected fluid into the balloon to expand those passageways to the sinus, and that allowed the passageway to then stay open after that, and it worked very well. There was a moderate amount of discomfort, certainly nothing that I would say an average person could not stand. I mean, and that was mainly just at the in passing the scope up for a very brief period, and then as the balloon expanded, again, very brief. There was, I don't really remember there was any significant pain afterwards. I did not need to take any pain medicine afterwards. To me, scuba diving is an essential part of my life, and this allowed me to continue that activity, and hopefully I can continue it for many years. It was really excellent. I mean, the waits to be seen by Dr. Wiggs were never very long, very efficient operation, very caring staff, and I would recommend it to friends and family for sure. I would say if you have a condition for which this procedure is thought to be helpful, and you had another alternative, in most cases the other alternative is going to be more invasive and have more risk, and this was really very low risk, a very easy procedure to do. Right here in the office, did not even require anesthesia, and I'm told by Dr. Wiggs that if the person is just, some people just cannot tolerate any pain, then they can do it under anesthesia as well.